İyi günler sevgili canlarımız. Medya Yelkeme Stüdyosu'ndan iyi ve sağlıklı günler diliyorum sizlere. Bugün Hilin'le birlikte şu anda İngiltere'de yapılan COVID-19 aşıları konusunda değerli konuklarımızla beraber sizleri bilgilendireceğiz. Lütfen program boyunca sorularınızı bize yazın ve biz Hilin'le birlikte elimizden geldiğince vaktimizin yettiği sürece konuklarımıza sorularınızı yönelteceğiz. Programımız İngilizce ve Türkçe olacak. O yüzden herhangi bir hatamız olursa affola. Bugün keyifli, bilgilendirici, aynı zamanda da zor bir yayın yapacağımızı biliyorum. Lütfen bizi yalnız bırakmayın. İAKM Cemil ve Yönetim Kurulu olarak sizlere faydalı bilgiler sunmak için çok çalışıyoruz ve güzel programlarla sizleri buluşturmak istiyoruz. Konuklarımı size öncelikle tanıtmak istiyorum. Konuklarım Dr. Precautions, kendisi local GP Haringey'den, Mortty, pharmacist Haringey'den, Owen Sloman NHS'den Assistant Director Haringey'den. Şimdi de Hilin'e vereyim ve Hilin konuklarımızı kendilerini bir tanısınlar istersen başlarsan.
Hiya, lovely to have you all here today. Would you like to introduce yourselves shortly for our viewers?
Which I did in Turkish, but it would be good if you do yourselves. Yes.
Would you like to start off first, please? I don't think we can hear you. Yes, now we can.
Yeah, thank you. Yeah, sorry about that. I was muted. Good afternoon, everyone. I'm so happy to be here. My name's Mortty. I'm a pharmacist, and I've been working in Haringey for over 20 years for the clinical commissioning group, supporting GPs in making prescribing decisions. Although I'm a pharmacist, I really, my passion is to try and get patients to live as healthy as possible with the minimum amount of medicines.
That's great, thank you. Peter Christian, would you like to go next?
Yeah, hi, I'm Peter Christian. I'm a GP. I've been a GP in Haringey for over 30 years. I live in Haringey as well. And I'm also a healthcare commissioner, and I work with Effa and Owen on the clinical commissioning group, which brings the healthcare services to you. And I have a passion for the rollout of this COVID vaccine to help protect people and save lives.
Great, thank you very much. Owen, would you like to finish off?
Yeah, thank you. My name's Owen Sloman. I'm the Assistant Director of Primary Care in Haringey, so a large part of the commission and the organising. And we're all working very intensively on the COVID vaccination programme. And the reason why we're here is to encourage as many people as possible to be vaccinated and to be safe from COVID. Thank you.
Thank you very much. That's great.
Before we go on to questions, Hilin, I would like to actually ask Owen, because with Owen we have been kind of writing backwards and forwards through emails. I just like to, I would like him to explain as to why there's a need to talk about COVID-19 vaccination. Owen, can you hear me? Sorry, Owen.
Yes, absolutely.
Hi, Owen. Can you just tell us why there is a need to talk about the COVID-19 vaccination among the ethnic minority groups in general? Why is it so important?
I think it's incredibly important for all of us that every part of our community is safe from COVID, every part. And we know that there's a lot of misinformation on social media. We know that people have concerns and people have fears and people have questions. And what we wanted to do today is to have a safe place where bring those questions, please. We have our leading GP doctor, we have our leading pharmacist who can talk about the vaccine. Bring those questions and answer them, and then go and get vaccinated, get your relatives vaccinated, and let's all be safe so that our community can then come together again. That's what we're trying to do today. Thank you.
Thank you.
I'll just say that in Turkish to our viewers, what Owen said.
Yeah.
Sevgili canlar, Owen'e sordum neden aşı, şu anda biliyorsunuz hükümetin aşılarla ilgili bir programı var ve herkesi aşılanması gerekiyor. Neden önemli diye sordum. Kendisi de doğru bilgiye ulaşmak için çok önemli olduğunu söyledi ve bu yüzden de bu programımızın yapmamızın amacı da sizin gibi değerli izleyicilerimize, canlarımıza healthcare professional'ların doğru bilgi aktarılması ve farkındalık yaratılması diye. Let's start with the question, Helen. Do you want to ask the question to our viewers? Who would like to answer that? We'll see.
Okay.
Do you want to?
Yes, I'm just going to simply ask, why are the vaccines important and why should people get vaccinated against the virus? Who would want to answer that? Yep, Christian, perfect. Is the voice?
Okay.
Oh, yeah, perfect.
Okay, so the reason that we're so passionate about this vaccine, this particular vaccine, we're passionate about vaccination anyway. Vaccination has been one of the great success stories of modern healthcare. Vaccination helps to protect us from diseases and illnesses that can kill us, basically. And the COVID vaccine is our way of protecting our population, not only protecting our population, but also to help protect our local hospitals who are overflowing at the moment with seriously ill people with the COVID virus. And this is why we're so passionate about the COVID vaccination. And this is why we're so anxious to come out, as Owen was saying, to reach parts of our community that perhaps have not yet received the message accurately to enable them to make this decision to take up the vaccine.
Perfect, thank you. Seyircilerimiz Peter Christian'a şöyle bir soru sorduk. COVID-19 vaksini neden olmamız lazım? Ve şöyle yanıt verdi. Vaksin için çok tutukluyuz ve modern sağlık hizmetini korumak amaçlı bu vaksini olmamızı öneriyoruz söylediler. Ve nüfusumuzu daha çok korumak adına vaksin olmamızı söylediler. Ve hatta hastanelerde şu an daha çok yaşlı kişiler olduğu için vaksini yaparsak yani bunun üzerinde önlem alabileceğimizi söyledi.
Okay. I'd just like to ask the second question, Helen. Okay. How do the coronavirus vaccine work? Do they provide treatment or protection against the virus? Who would like to? Yes, Peter.
I was pointing at Effa.
Oh, Effa. Let's hear from you. Hi, Effa. How do the vaccines work?
I'm muted. Okay, right. Thank you. Yeah. So they don't treat the COVID sickness disease, but they do protect you from it. So we have two types of vaccines. One's called the mRNA vaccine that everybody's heard about, and the second one's a vector vaccine. So the mRNA vaccine is what scientists have done is they've looked at the virus, and the virus has these spikes on them, and the spikes are made from protein. So the scientists have looked at the amino acid sequence of that protein, and they've sent that information round to many laboratories all around the world. And the scientists in these laboratories are able to read the amino acid sequence and put them together in a protein. So this codes for the spike of the vaccine, and that's what's called the mRNA. So they put it in a lipid particle and inject it into your body, and that infuses into your cells. Now your cells would read any messenger RNA that goes into them. So they would read this, and the cell has a factory, and it will reproduce the protein. Do you want to go on? Because do you want to explain it a bit before I go on? Okay.
Seyircilerimiz sorduğunuz soru doktorumuza COVID-19 aşısı insanı tedavi edebiliyor mu? Ve yanıtı şöyle oldu. COVID-19 aşısı insanı tedavi etmiyor ama COVID-19 virüsüne karşı çok koruyor. Evet. ve hatta aşı protein içeri amino asitle yapılan protein içerikli olan bir aşı ve evet çok koruyor. Şimdi devam edecek. Efal, back to you.
Okay, so after your body reads this code, it starts producing the spike protein onto the surface of the cell. And once your body sees it, the cells, your immune system sees it, it notices that this isn't part of our body, and then it generates an immune response and attacks it. So now your body has learnt when it sees that kind of protein, it will attack it. So when you do go and catch COVID, when you inhale COVID, it goes through your mouth, your nose, your eyes, your body will straight away will remember it and attack it. And that's how come you will not get severe disease, because your body is already primed.
Yeah. Okay, perfect. Let me just translate that quickly because that's really useful information. Seyircilerimiz Efa şöyle söyledi. Hücrelerimiz, vücutumuzdaki hücrelerimiz bu virüs aşısı olduktan sonra aşıdaki protein mesela hücrelere geçtiği zaman hücreler saldırı bir şeklinde saldırıyor, evet, ve böyle yaparak da insanı virüse karşı koruyor.
I think that's great,
Yeah.
Ellen.
Okay, so other vaccine, because there's two, and the second vaccine, which we call the vector vaccine, we use a virus that has been damaged, so it cannot replicate in your body. But in that virus, they put the code for the spike protein, and that infects you, and it goes into your cells. And again, your cells reads that code and produces the spike protein, to which your body generates the immune response.
Perfect, thank you. Seyircilerimiz ikinci bir aşı da olduğunu söyledi Efa Mortty ve bu
Vector vaccine.
evet, ve aynı şekilde bu vaksin de hücrelerle alakalı ve aynı şekilde bu da saldırı bir şekilde hücrelerle çalışarak insanı
İyileştirmeye
evet.
çalışıyor diyelim.
Aha,
Evet.
evet.
Evet. Bir sonraki soruya soralım. Ne dersin Hilin?
Tamam.
Ben tamam mısın? Yoksa ben devam edeyim.
Üçüncü, evet.
Okay, I would like to ask you another question, distinct panel. What vaccinations are being developed and administered in the UK? How effective are they? Who would you like to answer that? Okay. Hi.
I guess also another question.
Can they hear us now?
Perfect, yeah.
Yeah, okay, I'll take that one. So currently we have two vaccines that we're using. We have the Pfizer vaccine, I'm sure most people have heard of that, and then we have the Oxford AstraZeneca vaccine. Now the Pfizer vaccine is the mRNA vaccine, and the Oxford AstraZeneca vaccine is the vector vaccine, the one that comes with the virus. Now, they're both reported to be about 90% effective. We have other vaccines in the pipeline. We have several because it's a big country and we have many citizens we need to vaccinate. The other vaccines are Valneva that the government's ordered. They've ordered some vaccines from GlaxoSmithKline. There's one called Novavax. And then also they've ordered some from Janssen and the Moderna vaccine. Now, the Moderna vaccine is also licensed and ready for us to use. It's approved, but we haven't got any in circulation at the moment.
I'll just translate that into Turkish if you could screen me. Sevgili izleyiciler, Efa iki türlü aşı var şu an dedi. Bir tanesi Almanya'da biliyorsunuz üretilen Pfizer aşısı. İkincisi de Oxford AstraZeneca'sının, doğru telaffuz ettim. O aşı. Bu iki aşıda %95 efektif olduğunu, yani etkili olduğunu söyledi. Bir de Derma var ama Derma daha çok kullanılmıyor sanırım. Evet.
Ve hatta aşıların %90 da iyi.
95 daha koruyor.
Koruyucu
evet,
olduğunu söyledi.
Evet, çok etkili.
Etkili olduğunu belirtti.
Do you want to
Yep.
move on to?
I'll ask the next question. When you're getting the vaccines, is there any precautions that you should take before you get the vaccine and also after you get the vaccine? Any kind of precautions that you need to take? Oh, there's voice. Yeah. Can he Peter, I think?
Any precautions, Effa? This is more of a question for Effa, right?
Okay, I'll take that. Yeah. So, before you get the vaccine, you should make sure that you are well. So, you know, if you're not feeling well, don't go for your vaccine at all. So make sure that you are well. And when you're going for your vaccine, you would have to, you know, wear a mask and, you know, do all the things that you normally do. When you get there, it's you'll have to social distance just like you do everywhere else. And the vaccination centres are well set up for social distancing, so that will be fine. And when you get in, you will be assessed to make sure that, you know, first you're well and that you're not allergic to any of the components of the vaccine. And when they feel that you're well enough, you will get your vaccine. After you've been vaccinated, you would be asked to wait in a waiting area for a while so that they can observe you, just to make sure that you are not having any allergic reactions or any adverse effects from the effects of the vaccine. Now, you know, the other day, you know, there was a woman on TV who collapsed after having the vaccine just because she was scared of needles.
Okay.
Yeah, I think that's it really, and then you'll be allowed to go home. But when you go home, you still need to practice social distancing and protect yourself, because you won't be immediately protected, and then also you could still catch COVID during that time whilst you don't have any antibodies.
Okay, perfect. Let me just quickly translate that for our viewers. Seyircilerimiz şöyle bir soru sorduk Effa Mortty'ye. Aşıyı almadan önce veya sonra almam gereken önlemler var mı? Ve şöyle yanıt verdi. Sağlıklı olmanız lazım ve kendinizi eğer ki o gün iyi hissetmiyorsanız aşıyı olmayın. Ve aynı zamanda aşıyı yaptığınız zaman maske takmanız lazım ve sosyal mesafenizi de korumanız lazım. Ve şunu da söyledi, aşı olduktan sonra bekleme odasında bekliyorsunuz. Çünkü doktorlar gelip yani size bakıyor allergic gibi bir durum oldu mu diye. Ama ondan sonra bir de şunu da söyledi. Aşı olduktan sonra daha halen yani sosyal mesafenizi, maskenizi takmanızı öneririz söyledi.
Helen, there is a question from our viewers which I would like to kind of put forward to our panel. İsmini şu an Elif üstüne görmüyorum. Türkçe, tamam, sonra şey yapalım. Dilek Hanım mı sormuş? Tamam, Dilek Hanım şöyle bir soru sormuş. Herkes aynı aşıyı olmuyor. Biri diğerinden daha mı iyi diye sormuş. The question is this: there are different vaccines that are being rolled out. Is one better than the other?
Or which one would you recommend for people to do?
Or do they get a choice? I don't think they do.
Okay, so no, they're both as effective as each other. I think the main differences are the way they were made, because they're obviously, you know, they're two different types, but in the clinical trials, it has shown that they're both as effective. So really wouldn't recommend anyone over the other. You know, in the beginning, people had allergic responses to the Pfizer vaccine, but now they've overcome that, and really you will be assessed. If you're allergic to anything in any of the vaccines, then you can't have it. But I can't really say that one is better than the other, and at the moment you can't choose.
Okay. If I'll just translate that into Turkish. Effa soruya şöyle cevap verdi. Yani ikisi de aynı derecede etkili olduğunu söyledi. İlk başta Pfizer aşısına alerjik reaksiyonlar oluyordu ama daha sonra yani alerjiniz var mı diye de test yapıldığı için şu anda bir sorun yok. İkisi de aynı derecede etkili diye söyledi kendisi. Let me just look. I'm just looking at the question and trying to read what they're saying.
Shall I ask?
Yes, go ahead while I discuss their one. Please
we are getting a lot of questions.
There are lots of questions.
Hopefully we have as many as we can. There's a question from Gülşah Kırılmaz, and she's asking, they say that they will be vaccinated over the age of 6. How protective is it for children? Is there any data that's or any tests or any kind of data that's been released on children?
I will answer that. Yeah. So in the studies, they only tested on people over 16. That's the lowest they went. They haven't. They didn't test on children, and it's something that we don't do. So when you're running a clinical trial, you will not include children, pregnant women, and very ill patients, or depending on how ill they are. But so it hasn't been tested on children, but I heard currently that they are looking into children, whether children can have it or not. So those trials are ongoing, but at the moment, no, it hasn't been tested in any children.
Okay, perfect. I'm just going to translate that for our viewers. Seyircilerimiz Efa'ya şöyle soru sorduk. 6 yaş üstünde aşı olacaklarını söylüyorlar. Peki ne kadar koruyucu çocuklar için? Şöyle yanıt verdi. 16 yaş üstünde insanlara yapıldı bu aşılar. Yani çocuklara henüz daha test edilmemiş. Ama bunu söyledi. Yani bunu yapmadık ama şu anda çocuklarda yapmak için denemeler yapıyorlar ve araştırıyorlar.
Great. Can I ask you a question from the viewers? There's a question that is asking, what are the side effects of the Oxford vaccine?
Of the AstraZeneca?
Yes.
Yeah.
Do you like to answer that?
I'm very happy to answer that, actually, because my wife had it 3 days ago, actually. So,
all right. Excellent.
So some people are reporting some minor symptoms. I think perhaps one of the commonest is a little bit of soreness and tenderness at the injection site. Some people have reported feeling a little bit fatigued and under the weather, perhaps for a day or so. A little variety of mild symptoms. I think the Pfizer vaccine and the AstraZeneca vaccine are very similar, really, in terms of minor side effects. And I would really emphasize this, in terms of having a vaccination. Many people, of course, get nothing at all and are reporting this. And just out of interest, every day, on my phone, I have an app here, started by King's College Hospital, and I've entered the dates when I received my vaccination and which vaccination, and every day I enter if I have any symptoms at all of the COVID infection or any side effects after the vaccine. And this is just a little example of how wonderful and how quickly now we can collect data about things like vaccination.
Peter, can anyone actually have that app on their mobile, or is it just exclusive to you?
No, it was started, I think it was King's College or Imperial College, and you can download it as an app. It's called the COVID-19 app, and it's a wonderful way of our researchers getting real-time data. I think to date, Effa might know, I think there are probably 10, 20, 30,000 people are reporting every day.
Thank you so much, Peter. I'll just give me a minute. I'll just translate that into Turkish, what you said. Sevgili seyircilerimiz, yani yan etkileriniz, Oxford Vaccine yan etkilerini sormuştuk. Dr. Peter Christian da şöyle söyledi. Çok az bir semptomları çok az olduğunu söyledi. Yani biraz halsizlik olabilir. Ama Pfizer aşı da dahil olmak üzere ikisinin çok minor semptomları var. Birazcık sanırım biraz baş ağrısı değil de bir soreness, tam Türkçesi aklıma gelmedi. Soreness olabilir, halsizlik olabilir. Evet, ama ikisinin çok minor şeyleri çok az ve King's College'den COVID-19 app varmış. Telefonda indirebilirsiniz. Eğer bu aşılar hakkında hani yani etkileri nelerdir diye merak ediyorsanız bu app'i indirip telefonunuzda COVID-19 app'ini oradan side effect'lerine de bakabilirsiniz dedi. Çünkü kendisi de indirmiş sevgili Hilin.
Evet. Ben diğer bir soru soracağım. İzleyicilerimizden geldi. I'm going to ask the next question from another one of our viewers. The name is Bülent there, and he's asking, he's saying that they advise us to be vaccinated, but will any kind of responsibility for any bad side effects that may occur, will any kind of responsibility be taken from if any side effects do occur, bad side effects?
Do you mean by the companies that produce the vaccine?
Yeah.
Yes, yeah. Again, I think EFA is the expert on this.
Yeah, Effa, with you.
So, you know, in order to get support from, you know, the companies to fight the pandemic, in 2006, it was agreed that if a pandemic should hit the world, the companies will be, you know, excused from liability for certain things. So one of them will be civil liability if they have, like, if someone gets damaged by the vaccine. However, they are not excused from if the vaccine is faulty and therefore the patient gets harmed. However, there is a government scheme for, you know, compensating people who have problems from vaccines that they get. And that's what people will get if they should have a problem with the vaccine.
Perfect.
There's a views question I would like to ask.
Shall I translate that into Turkish?
Oh, sorry.
Yeah.
Yes, I forgot. Yes, of course. Go ahead, Hilin.
Oh, sorry about that.
Yeah.
Just for 2 minutes. But seyircilerimiz Bülent'lerin sorusu şuydu. Bize aşı olmamızı tavsiye ediyorlar. Peki herhangi bir kötü bir yan etkiye karşı sorumluluk alınıyor mu? Ve Effa Mortty şöyle cevap verdi. 2016'da alınan bir karardan dolayı pandemi eğer ki dünyaya vurursa sivil sorumluluk yok, ama eğer hasta zarar görürse hükümetin yaptığı bir plan var ve buna başvurarak yardım alabilirler.
Çok iyi. Hilin sanırım aynı kişi bir sorusunu ben de Bülent'lerin
tamam.
sorusunu da bir soru.
Evet, birkaç tane geldi.
Evet, çok soruyorlar.
Evet.
Virüsü izole ettiler mi? Lütfen sorun demiş. Yani have they managed to isolate the virus? One of the viewers is asking, have they managed to isolate the virus? Who want to reply or answer that question, please?
Have they managed?
Sorry, yes, Peter. Has the virus been isolated?
I'm sorry, can you say that again?
Have you managed to isolate the virus? What the views is asking.
Yes, I mean that has been one of the most remarkable things is how quickly the virus was identified and how quickly the researchers worked out the genetic code of the virus, and from that knowledge, of course, enabled the researchers to develop the vaccines that they knew would be active against this virus. And it's been one of the most amazing success stories of the application of modern scientific methods that has enabled them to do this. It used to be up until maybe 5 years ago that working out the genetic code of something took weeks or even months, and now it can be done in an incredibly short space of time.
Thank you, Peter. I'll just say that in Turkish. Sevgili Bülentler, evet diyor, çok kısa sürede yani izole edildiğini söylüyor. Çünkü genetik kodu normalde bu kadar çok çabuk çözüp de aşıyı bulmayın gerçekten çok etkili şey söyledi değil mi Hilin?
Evet.
Yani hemen çok kısa sürede biz bunu başardık dedi kendisi.
Evet, diğer soruyu ben sorayım.
Tabii sor Hilin.
Tamam.
Okay.
I'm going to ask the next question. So I'm going to ask, is it safe to get the vaccine if you have a health condition? And also, can pregnant women get the vaccination done?
I mean, I would say it's even more important to to accept the invitation to be vaccinated if you have a serious health condition. What we've learned during this pandemic is how serious it is to get ill with this COVID virus when you have another condition such as diabetes or chronic heart or lung disease. And so I would urge people, if you are in the group are being invited to be vaccinated, and if you haven't, and if you have a serious condition, I would urge you to accept the vaccination. It's very, very important for your health.
Perfect. Thank you. I'm just going to translate that because that's very valuable information there. Seyircilerimiz şöyle bir soru sorduk. Sağlık durumunuz varsa aşı yaptırmak güvenli midir? Ve Peter Christian şöyle yanıt verdi. Aslında sağlık durumunuz varsa aşı davetini kabul etmek daha da önemli ve bunu özellikle belirterek söyledi. Ve sağlık durumunuz varsa bir hastalığa yakalanmanın ne kadar ciddi olduğunu da öğrendik bu pandemi sürecinde. Mesela diyabet ya da kalp hastası olunca yani virüse daha da kötü yenik düşebiliyorsunuz. Yani aslında sağlık durumunuz varsa aşı olmanız daha önemlidir. Bunu söyledi Peter Christian.
Tamam. Bir soru ben de sorayım. Şöyle bir sorumuz var. Aşı olmak zorunda mıyız diye bir sorumuz var. Dear panel, the question is it really compulsory to get vaccinated?
It is not compulsory to be vaccinated in the United Kingdom. And my understanding from my reading of the newspapers and other articles is that I think it is very unlikely here in the United Kingdom that we would ever make a vaccination compulsory. I think some people have very strong views about this, perhaps either way. Some people feel that perhaps as part of our public health duty that one should be vaccinated. I would like to remind the audience that there are possibly two reasons that we are vaccinated. One is to protect ourselves, and one is to protect those around us, the rest of our community.
Perfect, thank you.
Şöyle söylüyor Peter, İngiltere'de aşı olmak gibi bir zorunluluğumuz yok. O yüzden Peter, can you just repeat what you said about America? I think I missed that point. Can you tell me what you say about whether so you say something in America that is it?
No.
It's not compulsory, is it?
Şöyle yanıt verdi.
I was making notes.
Yeah,
I missed that one out.
Peter Christian şöyle cevap verdi.
İngiltere'de
yani İngiltere'de zorunlu değil insanların aşı olması. Ama yani aşı olmak önemli çünkü birincisi kendinizi korumak için ve ikincisi de çevrenizdeki insanları koruyorsunuz aşı olarak.
Evet. Let me just look to do you want to...
Soruyu ben
sen sorana kadar ben de diğer sorulara bakayım.
I'm going to ask the next question from one of our viewers as well. We have a viewer called Carmen Köktaş, and he's asked, how does the vaccine come in for people who are allergic to drugs?
Should I answer that, Effa? It could be okay. So I think many people ask this question. I mean, there aren't really any drugs that would be contraindicated for a person to receive the COVID vaccine. There are a small number of conditions where a patient might be receiving a drug that is suppressing their immune system, and those patients will need to take advice from the doctors who are looking after their care. But they are a tiny number. For the vast majority of patients who are on the usual drugs for their heart or their lungs or diabetes, these are not a contraindication to receiving the vaccine.
Okay, perfect. I'm just going to translate that. Seyircilerimiz Kamil Köktaş izleyicilerimizden şöyle bir soru sordu. İlaca alerjisi olan kişiler için aşı nasıl gelir? Ve Peter Christian şöyle yanıt verdi. Bir hastanın ilaç alabileceği az sayıda koşul vardır. Ama bu durumlarda insanların doktorların tavsiye alması gerekebilir. Ama yani böyle diyabetik ya da kalp hastası olan kişilerde, böyle hastalıkları olan kişilerde yani aşı almama gibi bir durum yok. Yani aşı olabilirler.
Great, Hilin. Can I just forward a question to panel? Dear panel, there's a view question is saying that they say that 6-year-olds will be vaccinated. How effective or protective will be for the children?
I'm not aware at the moment that there are any plans to vaccinate children.
Okay, so that's a misinformation. Yes. Okay.
Yeah. At the moment, the COVID virus does not seem to affect children seriously. And this is a general statement. So I don't think there are any plans. There probably will be many more in the population who will be ahead of children in terms of COVID vaccination. And I would reassure parents about if they have strong fears about their children and the COVID virus.
Great, Peter. I'll just say that, explain that to our viewers in Turkish. Sevgili Gülşah Kırılmaz Bezirken, Peter sorunuza şöyle cevap verdi. Şu anda yani çocukların sanırım yanlış bir bilgi edinmişsiniz. Çocukların aşı olacağı hakkında herhangi bir bilgi yok kendisinde. Yani çocuklar bu süreci sanırım aşı olunmayacak. Doğru.
Evet, EFA da bunu söylemişti.
EFA da söylemişti. Evet, yani öyle bir şey yok diyelim.
Hı hı. Diğer soruyu
evet, ben diğerlerine bakıyorum. Sen sor istersen.
Question. It's from Fatma Batmaz, watching us as well on the live. And she said that there's rumours that people who do not have the vaccine, they cannot go abroad. How comes we are not obliged to this? Is it true?
I've not read anything or been told anything about people actively being stopped from travelling abroad if they have not received the COVID vaccine. I think there probably will be many people who will perhaps argue that this should be the case because, of course, people moving to a different country, we don't want them to spread the virus. Now, at the moment, we're still waiting for data that tells us how much the vaccine protects us from spreading the virus. We are optimistic at the moment that perhaps the vaccine does. I think many people think that we will eventually end up with a COVID sort of passport, which may be needed perhaps here in the United Kingdom as well as travelling abroad. But I have no knowledge at the moment that there is any firm plans on this.
Okay, perfect. Thank you. I'm just going to translate that. Seyircilerimiz Fatma Batmaz'dan gelen bir soru var. Diyor peki şu söylenti var. Aşı olmayan yurt dışına çıkamaz deniliyor. Doğru mu hakkında bir soru sordu. Ve Peter Christian şöyle yanıt verdi. yani yanlış bilgi, çünkü kendisi aktif olarak duyulduğunu görülen yani ya da duyan birisini kendisi aktif olarak birisinin durdurulduğunu görmedi veya duymadı. Onun için yanlış bilgi olduğunu söylüyor ve şöyle bir şey de söyledi. Muhtemelen virüsü yaymamak için durumun böyle olması gerektiğini düşünenlerin çok olduğunu söylüyor ve bu yüzden de insanların belki COVID'li bir pasaport alabileceğimizi düşünüyor ileride.
Hilin, bir soru var, onu da soralım. Diyorlar ki aşı yapıldıktan sonra ne kadar sonra vücudu korumaya başlar diye bir soru sormuş. There is a question from our viewers in the panel. They're asking, after the first dose of the vaccination, how soon it will protect the body?
The first dose of the vaccine, as I say, I believe I'm looking at EFA, takes 2 to 3 weeks before you get the immunity from it. And then we do know that it is the first dose that gives you most of the immunity. The second dose is like a booster dose.
Okay.
That's important. If I could say something else?
Yes.
Please.
Is just to say to everybody that the most important thing about the vaccine at the moment is not about many of us wanting to travel and so forth. It is primarily about protecting our most vulnerable and elderly population from this serious virus. That is the prime importance of the vaccine rollout at the moment.
Yeah.
Thank you, Peter. I'll just translate that to our viewers. Şöyle söylüyorlar, yani ilk aşı olduktan sonra 2-3 hafta sonra vücut immunity yani bağışıklık kazanıyor musunuz? İkinci aşı sadece onu bir daha çok güçlendirmek amacıyla yapılıyor. Bu aşı olduktan sonra biliyorum bazıları hemen yani yurt dışına seyahatlere falan gitmek istiyorlar ama bu aşının asıl amacı gerçekten kişileri korumak olduğunu söyledi.
Diğer soruyu ben sorayım.
Tabii, Hilin. Go ahead.
Yeah.
Can I just, Hilin, before you start, can I just ask our colleague how long we have? Hassan, can you tell us how long we have to close the program, please? So we know. We have 30 minutes to go.
30 minutes.
30 minutes, okay.
Perfect.
Thank you.
Yeah, plenty of time to get some questions.
We'll get lots of questions.
Another one of our viewers, Kamil Köktaş, has asked people who are vaccinated, how likely are they to catch the virus, to get the virus after being vaccinated? Is it likely?
I think Effa wanted to come in, so I'll hand this one to her.
Yep, perfect.
Thank you.
I just wanted to say before I move on to answering that question, you know, about traveling, I think it will be a really good idea if you are offered the vaccine to get vaccinated before you go, because unfortunately in my community, many people traveled from the UK to Ghana, where I originate from, over Christmas, and several of them passed away when they caught COVID there. So if you do have the opportunity, and you know, Ghana, the healthcare is not as good as it is here as well. So when they're sick, they have to deal with the healthcare system there, and it is a big worry. So I do feel that if anyone's thinking of traveling, it would be a good idea to wait to get your vaccine first before you travel. Anyway, so then the question about, there's a bit of an echo, sorry. So the question was, if you get vaccinated, will you be able to transmit COVID? Was that the question, please?
Yeah, transmit and also catch the virus again.
Right, okay. So yes, if you are vaccinated, you have a percentage of protection. So after your first vaccine, after about 2 to 3 weeks, you will be 70% protected. So you could catch COVID after that time. But if it's before that time, you could catch COVID and get full-blown disease because you wouldn't have enough antibodies. After to 3 weeks, you are protected. You might catch COVID and it might be quite mild. We don't really know how bad, but most probably it will be quite mild. And after your second dose, you would have maximum protection. So maybe you could be asymptomatic, so you won't have any symptoms, or maybe you might have a mild dose of it. We're not so sure, but studies are showing from Israel, who have vaccinated several people, that less than 1% caught COVID after having 2 doses. So we're still learning, but as we go forward, we will find out more. But the other thing that I want to say is, because there's variants around, sometimes, you know, if you catch COVID from a different variant, you might be ill. The scientists are saying so far that even though you might be ill, you might not be ill enough to go into hospital or even die from it. So you will get some sort of protection from the variant. So the vaccine is really good. And yeah, we're just sort of watching the data and finding out what will happen in the future.
Okay, perfect. I'll translate that. Öncelikle soruya geçmeden önce Mortty Peter Christian'ın söylediği seyahatle ilgili de birkaç cümle söyledi ve şöyle söyledi: yurt dışına çıkmadan önce insanların aşı olması çok daha iyi bir fikir, çünkü kendisi örnek verdi, Gana'dan olduğu için birkaç kişi oraya gidince aşı olmadan gitti ve gribi yakaladılar. Onun için yani seyahat etmeden önce aşı olmak çok daha iyi, bunu belirtti. Ve seyircimizden gelen bir soruyu da sordum kendisine. Ve şöyle yanıt verdi. Yani koruma yüzdesi 2 ve 3 hafta arasında %70 koruması var. Ve korumak için yani şöyle bir şey söyledi. Yani kesinlikle aşı olursanız bir çeşit, yani bir şekilde koruma alacaksınız. Onun için aşı olmanızı öneriyor doktorumuz.
Helin, sorayım ben. Bir sorumuz. There's a question from our viewers. They're asking, is it still possible to catch the virus after receiving the first dose? Peter, do you want to answer that question?
Well, yes, it is, because I'm afraid it's not that the vaccine is 100% effective. But as I say, what we are very optimistic about is that if you are still unlucky enough to catch the virus, it will be in a very different and milder form. And this again is the reason why we're so keen for people to be vaccinated.
Birinci dozdan sonra COVID'e yakalanabilirsiniz. Birinci aşı olduktan sonra yakalanabilirsiniz ama vaksinler %100 etkili değil. Ama yakalandığınız zaman daha çok az geçiriyorsunuz. Yani çok etkileri çok biraz fazla olmuyor diye söylüyor. Yani minor form diye bir cümle kurdu kendisi.
Diğer soruyu ben hemen sorayım çünkü zamanımız kısıtlı.
Ne kadar var? We have.
Next question is from Eylem Ezra, and she's asking, is the vaccine safe for pregnant women?
The vaccine, I think I would defer to Effa on this one, but
yep. Perfect.
When it comes to pregnancy, on 30th of December, the MHRA, which is our regulatory body that approved the vaccine, before they said, no, don't give it to pregnant women, but now they've changed their advice that breastfeeding women and women who are pregnant should have, like breastfeeding women can have the vaccine, but women who are pregnant need to discuss with their doctor the risks and the benefits from having the vaccine. Now, especially for those women who are in the later stage of pregnancy, we're finding that catching COVID can be quite severe because their lungs are already squashed due to their pregnancy. So that people are having these discussions with their GPs. And also if you have an underlying clinical condition, that will put you more at risk if you catch COVID and get a severe outcome from it. So now people who are pregnant can discuss with their doctors whether they want to have the vaccine or not.
Perfect, thank you. I'm going to translate that. Seyircilerimiz Eylem Ezra'dan sormuş şuydu. Virüs aşısı hamile olan kadınlar yani yapabilir mi aşıyı? Ve Efa Mortty şöyle yanıt verdi. MHRA öncelikle kadınlar yani hamile olan kadınlar aşıyı yapamaz diye tavsiyede bulundular ama Aralık 30. gününde bu tavsiyelerini değiştirdiler ve hamile olan kadınların doktorlarıyla bu aşı olmayı danışmalarını önerdiler ve doktoruyla birlikte yani aşı olabilirler mi bunu konuşmalar lazım ve özellikle hamile olan kadınlar yani daha çok en son zamanlarda riski daha yüksek. Onun için doktorlarla konuşmasını önerdi Efa Mortty.
Süper, çok iyi. İki soru var Hilin. İki tane gelmiş. Onu da bir soralım.
Tamam.
Dear panel, there are two questions that I would like to ask you. The first question is this. Should you have the vaccine if you are allergic to eggs? The first question. Peter, Efa?
The vaccine has not been grown on egg fibroblasts, which is what some of the older vaccines were, to the best of my knowledge, Efa.
You can have it.
You can have it.
Yeah.
They can have it, so they can have the vaccine.
Yes, they can have the vaccine.
All right. Şef Nur, vaksin eğer yumurtaya alerjiniz varsa aşı olabilirsiniz. The second question I would like to ask you, dear panel, is that when will 50 and 60 years old get invited for the vaccines? Our viewer is asking. What do you say to that?
Can I answer that? So
go ahead.
Yeah, so I am 54 and someone passed on a vaccine. When will you have your vaccine up to me? And I put my age in and I was told that I'll get my first dose in April. So there you go. And my second dose in July. So just an estimate.
Did you say you will have your first dose in April?
Yes, that's what the app told me. It's like an NHS track.
Yes.
To have your vaccine.
Great, okay. Efa, Fatima Batmaz, Efa kendinde... Okay, just Owen wants to say something. Can I just say what Efa said, then we'll go to Owen. I don't want to forget. Yeah. I don't want to forget what she said, Efa said. Fatima Batmaz, Efa kendinden örnek verdi. Ben 54 yaşındayım dedi ve ben ilk vaksin yani aşımı Nisan'da alacağını söyledi. Go ahead, Owen, do you want to say something?
Oh, just quickly, I think it will vary from area to area when someone's called, and also if they have underlying health conditions. I think what we're all saying though on the programme is when you get the call or the offer, please take it quickly for the sake of yourself and for the sake of the people around you. Thank you.
Okay, Owen de şöyle söyledi Fatma Batmaz. Yani bu bulunduğunuz bölgeden bölgeye değişiyor. Bir de eğer kronik hastalığınız varsa ona göre değişiklik gösteriyor. Eğer kronik hastalığınız varsa herhalde daha erken çağrılar diye ben düşünüyorum. O yüzden sizinle iletişime geçirdiği zaman lütfen hiç aksatmadan hemen aşı için randevunuzu yapın. Hilin, do you have...
Yep. I'll ask the next question. There's a question from Carmen Kukcha, who's just simple question. He's asking, are vaccinated people given cards after they're vaccinated to say that they have received the vaccine? Efa?
Yeah, I'll answer that. Yes, you are given a card, and that's just for your record. But wherever you're having the vaccine given to you, they are keeping a record as well and notifying your GP. So your GP will have a record of the vaccine, that you've been vaccinated and which vaccine you've been given.
Perfect. I'm just going to translate that.
I don't see the TV correctly. There are cameras in front of me.
Oh, I was just holding up my little slip of paper when I received my dose of a vaccine. I keep it in my wallet to proudly show.
Oh, good.
Oh, perfect.
Wow.
I'm just going to translate that. Seyircilerimiz Kamil Köktaş şöyle bir soru sordu. Aşı olan insanlara kart veriliyor mu? Ve Efe Mortty şöyle yanıt verdi. Kayıt için bir kart veriliyor ve aynı zamanda GP'nize de bu bilgiler aktarılıyor. Yani hangi aşı olduğunuzu, hangi gün, hangi saat olduğunuz, yani bu information hepsi GP'nize zaten gidiyor.
Aha. Hilin, ben bir soru sorayım.
Tamam.
Şöyle diyelim. Yani sanırım söylediler ama yine de bir sorayım. Yani bu herhangi bir do they get a choice about which vaccine were given? Do we get a choice about which vaccine that we get?
No, there isn't a choice of vaccine at the moment. When nobody is able to offer that choice at the moment in the United Kingdom. The supplies of each vaccine are at the moment not reliable enough to be able to offer choice. And to be quite honest, there is no reason to offer choice at the moment. It's not because any one vaccine confers a huge advantage over another. So people should not worry about that. They should accept whichever vaccine is on offer on the day that they're called for their appointment.
Perfect, thank you.
Yeah, go ahead. Yeah.
Şöyle yanıt verdi Peter Christian. Yani hangi aşı olmanız için seçim yapamazsınız. Yani seçim yok ama aşıların hepsi yani aynı derecede insanı koruyor. Onun için seçim önermek için hiçbir sebep yok. Yani insanlar hangi aşı, yani onlar size denk gelirse yani olmanızı öneriyor.
Herhangi ikisinin arası
aynı.
Sanırım bir de şöyle söyledi. İkisinin arasında da pek bir fark yok. İkisinin bir avantajı, birbirine karşı bir avantajının
yani
da olmadığını, ikisi de aynı
evet.
dedi. Evet. Can I just ask a question, dear panel? Will the vaccine become a yearly injection like the flu vaccine?
Yeah, we don't know for sure. We don't know for sure at the moment, but I think most of us in the business, so to speak, think that the way this virus reacts and produces variants is that we think the future will look like at least a yearly booster vaccination, which will probably be adjusted each year. And this is very similar to the flu vaccine that we give every year. The flu vaccine is slightly different every year, depending on which strains of flu are around on the eastern side of the world, because those are the ones we get later in the season. And that's how every year the flu vaccine is made up. So I think many of us think that the future will look like, probably for the vast majority of us, that we will be offered a yearly booster.
Okay. Şöyle söyledi, soru sordum. Yani biz böyle flu aşısı gibi senede bu COVID aşısına olacak mıyız diye soru yönelttim Peter'a. Peter da evet, büyük bir ihtimalle yani flu aşısı gibi biz de senelik aşı COVID aşısı olunacak diye cevap verdi.
Evet, booster olarak.
Booster yani. Olarak koruma amaçlı evet. Yani. Hı-hı. Evet. Sen bakarken Hilin, ben de diğer sorulara bakayım. Tamam. Sen bir bak oradan. Bayağı bir sorularımız geliyor sanırım. Çok güzel bir program oldu ve çok birbirinden değerli konuklarımızla onları cevaplıyoruz.
Tamam. Ben bir diğer soru sorayım o zaman. Going to ask the next question. how is the vaccine given? Is there only one injection that's given to the patient that's receiving it?
Yes, it's one injection. It only takes a few seconds. In fact, many people, when I've been vaccinated, many people don't even know they've had it actually when you finished. So it literally takes a few seconds just to put the vaccine into the muscle of the shoulder.
Okay.
Helen, you're going to translate that?
Yeah,
what he said. Okay, go ahead, then I'll ask a question.
Seyircimiz şöyle bir soru yönelttim Peter Christian'a. Aşı nasıl yapılır? Sadece bir enjeksiyon mu? Ve şöyle cevap verdi. Sadece bir enjeksiyon ve sadece birkaç saniye sürüyor. Ve hatta enjeksiyonu yaptığı kişiler hakkında da şöyle söyledi. İnsanlar aslında fark etmiyor. Yani omuz kasında birkaç saniyelik süren bir enjeksiyon.
Tamam. Şöyle bir soru gelmiş. Dear panel, there someone in the comment is asking, vaccines causes infertility. Is this true?
No, it's completely untrue.
Okay. Yok böyle Nazlı Orman Keskin, hayır bu doğru değil. Yani toplumda kısırlık yapıyor diye bir söylenti varmış. Bu doğru değil diyor. Bir soru daha sorabilir miyim Hilin? Can I just ask another question, dear panel? Is asking, should cancer patients have the vaccine? What do you say?
Cancer patients, of course, again, they have a serious condition. And as such, we, of course, want to protect them just as much as we want to protect everybody else. You know, my only proviso is that some people with whatever cancer they have might be receiving treatment and they might need to check with their specialist clinician. But they will be told quite clearly if there is any problem about them receiving the vaccine. But again, the big message to everybody is this is a serious, serious illness, and we want to protect everybody, especially those with an underlying other serious health condition.
Okay, thanks Peter. I'll just translate. Demet Doğan'ın sorusu kanser hastaları aşı olmalı mı sorusuna Doktor Peter Christian şöyle bir cevap verdi. Biz bu hastaları da diğer kişiler gibi korumak istiyoruz. O yüzden yani kanser hastaları evet tedavi görüyorlar ama onlar da aşı olabilirler dedi. Öyle değil mi Hilin? Ama zaten bu konuda çok dikkatli davranıyor tedavi oldukları için. Evet, sorunun cevabı.
Klinikinden de
bilgi alabilirler, evet.
I'm going to ask the next question. Can allergy sufferers get vaccinated? This was a question that was asked by Semra Çekir, watching us on the live.
I'm pointing at Effa.
Effa?
Yes. Yeah. So if you have an allergy, you're allergic to certain things, and we know what the vaccines contain. So they have the bit of the protein, the coding for the spike protein, and they have some salts and some sugar. Some have a little bit of alcohol. So you will be asked if you're allergic to any of those components, and if you are not, then you can have the vaccine. They at the centres also they have an algorithm, like a path that you follow. So they will ask you the question, are you allergic to this and what happened? Then they can decide whether you can have the vaccine. If you've had the vaccine before and you're going for your second dose, and when you had the first dose, you had an allergic reaction to that, then, you know, it will be considered whether you would have to have the second dose at the centre or you might have to go into a hospital setting to have your second dose. But that will all be assessed when you go in to have your vaccine.
Perfect, thank you. I'm going to...
If I could add to that, we have to date delivered 14 million doses of this vaccine to the people of the United Kingdom. The number of serious allergic side effects is unbelievably rare, isn't it, Effa?
Yeah.
Perfect. I'm going to translate that because that is valuable information there. Sayın seyircilerimiz, Semra Çelik'ten bir sorumuz geldi. Şöyle soru sordu. Alerjisi olanlar aşı yaptırabiliyor mu? Ve Effa Mortty şöyle cevap verdi. Yani ilk dozu aldıktan sonra eğer ki bir alerjik reaksiyonunuz yaşadıysanız o zaman ikinci dozu aldığınızda doktorunuzla konuşmanız lazım. Ama zaten yani aşıyı ilk aldığınızda yani size alerjiniz var mı hakkında birçok soru zaten doktorlar zaten soruyor. Çünkü aşının içinde protein var, tuzlar var, şekerler var ve alkol da olduğu için yani size zaten bu soruları doktor soruyor aşı olmadan önce. Yani alerjiniz var mı diye ki alerjik bir reaksiyonunuz olmasın. Ve Peter Christian da aslında Effa Mortty'nin yanıtına o da bir şeyler söyledi. Ve şöyle dedi yani ülkede 14 milyon doz üretildi ve yan etkisi olan çok nadir. Yani çok az bir sayıda yan etkisi olan insanlar oldu.
That's perfect, Helen. Dear panel, my colleague is actually warning me, saying that we have got 15 minutes left. Before that, I would like to ask Effa a question. Effa, you can hear me.
Yeah.
The pharmacists in Liverpool, Bristol, Southampton, Chester, Cheltenham are administering the Oxford AstraZeneca vaccine in stores. Will pharmacists store in Haringey administer COVID-19 vaccine? What do you think? What do you say?
Yeah, we have one pharmacy that's administering the vaccine. They are on in West Green Road. So
West Green Road, okay. Do
yes,
you
on
remember
West
the
Green
name?
Road.
That's
Remember the name. It's just you can't just walk into the pharmacy. You have to book. I have to go on the national booking system to book your vaccine.
Okay.
Yeah.
I'll just say that. Şöyle bir soru yönelttim. Effa kendisi de eczacı olduğu için çok da bilgili. Sorulara gerçekten sevgili canlar çok değerli konuklar ve çok güzel cevaplar veriyorlar. Çok da donanımlılar. Effa şöyle bir soru sordum. Yani Liverpool'da, Bristol'da, Southampton'da, Chester, Cheltenham'da eczanelerde COVID-19 aşıları olunmaya başlamış. Biz biliyorsunuz Cemevi'de Haringey bölgesinde olduğu için burada birçok eczaneler var. Eczanede de aşı olabilir miyiz diye bir soru yönelttim. Kendisi de bir tane West Green Road'da bir eczanede aşı oluyormuş. Onu söyledi ama randevu yapmanız gerekiyormuş oraya gidip aşı olmak için.
Can I add to that?
Yes, of course.
So yeah, I just wanted to say that, but you have to be in the cohorts that we are vaccinating currently. So you can't just, not anyone can book. You have to be above 65 years old or have a condition before you can book on the national booking system. And then when it opens up further, then other people can book online.
Okay. Effa şöyle de bir ekleme yaptı. Herkes gidemiyor. 65 yaş üstü olmaları gerekiyor. Book yapmaları için randevuyla bu yere eczaneye gitmeleri için diye de bir düzeltme ve ekleme yaptı arkasında. Şöyle çok az sanırım bir sevgi yönetmenim ne kadar zamanımız kaldı? We have 10 minutes. Okay. So dear panel, we have 10 minutes. Are there any questions? Let's just have a look.
Yeah. There are a lot of questions.
Okay, and
I'll ask the next one. It's from Kamil Köktaş, and he's saying, how many years is the protective time of getting vaccinated? So is there a time frame that you will be protected after you get the vaccine?
Okay.
Effa, would you?
Okay, yeah, I'll answer that. So at the moment, we don't know. We're still learning, and you know, people who are being vaccinated some people will have their antibodies monitored to see. But as Dr. Christian said, that you know, with the new variants coming out, if we're finding that what we're being vaccinated against now is not helping us as well as we go into the future, you might still need another vaccine. So far, we don't know. It could be a year, it could be 18 months, or we could even have to have a booster in autumn to protect us as the virus changes.
Okay, perfect. I'm going to translate that now. Sayın seyircilerimiz Kamil Köktaş şöyle bir soru sordu. Aşı olmanın koruyucu zamanı kaç yıl? If I'm yanıt ve sonra yani toplumun bilgilerine göre yani gene aşı olmanız gerekebilir. Yani booster yapmanız lazım olabilir. Ama yani yeni varyantlar uygulandığı için yani bir tane
virüs
aşı
mutasyona uğradığı için bir tane önerdiler, öyle değil mi?
Evet.
Şöyle, can I just, I would like to ask a question to Efa. Efa, you can hear me. I just like to ask you a question. Do we need to keep wearing a mask and keep the social distancing measures after we received our vaccination?
Yes, you would have to continue, because first and foremost, you know, you might not, it's not 100% protection. And also you might also be able to get infected and not get symptoms, but you could still pass on that infection to other people. So until we know more information about how our bodies respond following the vaccination and how well it works, we cannot stop practicing social distancing.
Efa, I would like to ask you, Efa, why, can you tell us, I know that Owen, in the beginning of the program, Owen did say a few words about that. Why, can you tell us why it's so important for the BAME community to get the vaccination?
So what we were finding from the previous wave was the BAME community was sort of more at risk of poor outcomes from catching COVID. We don't know exactly why that is. It could be because they have lower vitamin D. It could be because it could be genetics, but then also it could be because of the comorbidities that we seem to have more frequently than the other communities. So that's why it's very important if you from the BAME community to get vaccinated.
Perfect. Thank you, Efe. I'll just translate what you said. Efe'ye şöyle bir soru yönelttim. Ne oldu? Owen, can I just say this and then we'll take Owen's what Owen will have to say. Eva, şöyle bir soru yönelttim. Yani bu benim community'lerin etnik minority grupta dahil olmak siyahlar ve etnik minority grup Asian, etnik minority gruptaki community'nin neden aşı olmaları bu kadar önemli diye soru yönelttim. Kendisi de bu community'de bu virüse yakalananların çok fazla olduğunu söyledi. Belki de vitamin D eksikliğinden de olabilir ya da genetik faktörlerden de kaynaklanabilir ama o yüzden çok önemli bu aşı BAME community'nin aşı olması gerektiğini söyledi. Owen, do you want to say something?
Yes, just to say that the early evidence is that there is some lower take-up of the vaccine among some communities, including the Turkish-speaking community.
Okay.
And what that will mean is that the Turkish community will be more at risk of catching and passing on COVID, and that's desperately sad, and we can't have that. So that's why we want to encourage all Turkish-speaking people to take the vaccine.
That's partly the reason why we're here and having this discussion, isn't that right, Owen? I'll just say that I'll say in Turkish what Owen said. Owen özellikle Türkçe ve Kürtçe konuşan toplumunda aşıya karşı bir direnç olduğunu söyledi. Yani aşı hakkında korkuları var. O yüzden bu programı da zaten biz Owen'le beraber organize ettik. Bu programı yapıyoruz. Aşının önemini anlatmak için.
Perfect.
So how long do we have? We have 5 minutes left. Okay, should we have just last questions, Helen?
Okay.
One or two questions, and then we'll close the program for today.
Yeah. There's a question by Bülent there, and he's asking, why is social distance and wearing a mask necessary after you've received the vaccination?
I think Effa just answered that. Is basically the vaccine is not 100% reliable, so we don't want people to contract the COVID virus, and also we're not still sure is whether people could be still passing on the virus even if they've been vaccinated. So the message very clearly is that we still, all of us, have to wear a mask and to continue social distancing for the moment.
Okay, cool. I'm going to translate that. People have been asked.
I'll ask my last question,
Yeah.
and then we'll close the program.
There's a question. Sayın seyircilerimiz, şöyle bir soru geldi Brent'lerden. Yani aşı %90 koruyorsa neden sosyal mesafe ve maske gerekli? Yani aşı olduktan sonra, ve Peter Christian şöyle yanıt verdi. Yani %100 aşı güvenilir olmadığı için yani maske takmamız, yani sosyal mesafe korumamız halen gerekli. Çünkü yani virüs, yani toplumu korumak amaçlı sosyal mesafe yapmamız gerekli.
Onu söylemişlerdi de, evet, çok önemli diye. Evet. Tamam. Helin, bir son soruyu sorayım ben.
Evet.
Programımızı kapatacağız. Dear panel, I do have a last question to you. I think this will be the last question, and then we'll have your comments and close the program afterwards. The question is this: the viewer is asking, I have diabetic, high blood pressure. Should I have the vaccine?
Absolutely. That's really important. I would urge them.
Yes, okay Peter. Evet, bizi kıraki yani aşı olabilirsiniz diyelim. Dear Owen, Peter and Effa, lovely to have you and on this program. I'm so happy. I believe that it has been a knowledgeable program. Can I have your last comments and we'll go off air?
I'm very happy to start. So the big message to everybody out there is the COVID virus is a serious illness. If you are in the correct group to be offered the vaccine, I would urge you as a doctor to please accept the invitation to make your appointment and to have this vaccine. It will quite possibly save your life. And I plead with you to accept it. As Owen said, we are aware of a lower take-up in the Turkish community, and it breaks our hearts to think that there are people in that community who are not accepting this vaccine and the protection it offers.
Thank you.
So I will say that if you got cold in the past and you've missed your vaccine, you can still go and get it. So you could contact your GP, phone 119, or go online and rebook your vaccination. And also, after you've got vaccinated, do also practice some lifestyle measures to keep you healthy and fit.
Thank you.
And I will go last. I thank you very much. What I wanted to say is, now please take the vaccine when you're offered it, but also speak to your relatives, your friends, your neighbours, and encourage them to take the vaccine, because it's only by working together and coming out of it together that we're going to make our community safe, and so we can all live as we want to live again. So thank you very much.
Thanks so
Thank
much,
you.
Owen. Thank you. Sanırım we are having questions, I know, but we are about to close the program. I'm sorry. Perhaps we might have another program. So we just, Hilin, say what day say, and then we'll close off.
Yeah, it was a pleasure to have you here today. Thank you very much. I've really enjoyed the discussion, and I hope that our viewers gained valuable information also. Thank you very much.
Bye-bye. Thank you.
Bye.
Thank
Thanks so
you.
much.
Bye.
Bye.
Bye-bye.
Çıktık mı? O zaman çıktıksa konuklarımız sorularken de dediklerini bir söyleyelim. Öyle programı kapatalım. Peter şöyle söyledi. Yani gerçekten virüsün çok ölümcül olduğunu, mutlaka aşı yaptırmaları gerektiğini söyledi. Owen de aynı, yani arkadaşlarınıza, ailenize, akrabalarınıza söyleyin. Kesinlikle aşı olunması gerekiyor diye söyledi. Sevgili canlar, bugün sizinle bir programla bir de medya YKM olarak sizinle birlikte olduk. Ben burada emeği geçen bütün herkese ve yönetim kuruluna teşekkür etmek istiyorum. Arkada sevgili Elif Erbil, çok sağ ol. Bugün beni kırmayıp geldiğin için sana da bütün soruları söyledin. İbrahim Has yönetimden ve başkanımız da arkada. Hasan da bu yayını gerçekleştirmede yardımcı oldu her zamanki gibi bize. Çok teşekkür ediyorum. Herkesin emeğine, yüreğine sağlık. Bir dahaki programda görüşürüz. İyi günler.